Hi, I'm Kevin Wilk, physical therapist, Birmingham, Alabama. We're going to demonstrate some linkage between the upper extremity and lower extremity, in particular targeting the lower extremity patient. In this case, we've got some TheraBand CLX around Luke's shoes. He's also got crisscross to create a little bit more resistance on his hip abductors, external rotators, and he's holding it in his hands. What we're going to do are some lateral lunges, but we're going to have him abduct and externally rotate at the shoulder. Go ahead, Luke. Slow. Get long. Good. Keep going. Good job. All the way down. Come on back. So the idea is keep the knees flexed about 30, 45 degrees. Hip abduction. Working his glute med, glute max. Arms up now, Luke. High. There you go. Keep them up. Keep them up. Keep them up. There you go. And down again. Same way. Nice. Stay long. Knees bent. So now what we're going to do are some fast reversals. Go. Reverse. 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 Good. Stay low. Reverse. 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 And stop. Again, we're going to link the lower extremity, in this case the left leg, to the right shoulder, but we're also going to try to activate his hip abductors and external rotators a little bit more. We've got CLX band that he stepped into, so it's around his leg. I'm going to wrap it around twice, just so from a standpoint that the band can't migrate or slide up the leg. That locks it in place. So go ahead and loop it in your hand, Luke. He's going to do a front step down. His arm is going to be abducted and externally rotated. And in this scenario, he's adding his own resistance as far as for his hip abductors, external rotators. So he does a front step down, pelvis nice and level. Good. Hesitate, back up. If he wants less resistance, lower the arm. There you go. Makes it a little bit easier. Going back up. There you go. Often I ask patients to come all the way out to the side like this. There you go. A little bit tougher. Longer lever effect, but again, we're trying to activate and telling him we can use a mirror here for feedback, keeping his knee nice and straight, keeping it from going inside that first ray or his big toe. Excellent exercise for eccentric quads, but also controlling the valgus collapse to the knee joint. Relax for a second, Luke. You can step down. We can even keep that band on, and we can even ask him to keep his arms up like this and simulate a couple jumping motions and landing. Come on up. Jump. Good. And land. Good. Again. Good. This way it's creating a little bit of load, bringing his leg into a valgus position, and he has to stabilize again using his hip. The next two exercises are related to golf. We've got the CLX band still around Luke's leg. He's got it in his hand. What he's going to do is get into the stance position for golf. He's going to externally rotate, so the backswing. And when he gets his arm up and out, I want him to abduct his leg. Good. Again, same way. So this way he's linking again his shoulder to that lead hip, which is really important, obviously, in golf, to be able to abduct, externally rotate the drive through. So now we've got the CLX band on the opposite leg. We've wrapped it around the front of the hip, around his back, and into his lead hand. So now, here's the stance phase of the golf swing. We'll ask him to start back here in the downward swing or the down phase. And then we'll just ask him to accelerate through the ball and follow through. This way he's exercising, keep going. He's exercising the back of the shoulder, posterior cuff, his deltoid, scapular retractors, rhomboids, middle trap. We just want him to, just like with a golf swing, just come right through. Just right through. He can also activate his hip a little bit as he's coming through. Abduct, there you go. Weight shift. Perfect. Good. Use your hips, rotate a little bit. There you go. Excellent. Two more. And relax. These are good exercises to do even in the kind of warm-up phase, if you will, before going out on the golf course to prepare the body, but also give flexibility, a dynamic warm-up, but also activate the muscles that are important in the golf swing.